Hi, everyone. I'm really pleased to be involved in the ODI Open Saves Lives Unconference to talk about the work that I'm doing with the All-Party Parliamentary Group for Longevity, and especially, and the focus of today is the Open Life Data Framework. So I'm Tina Woods, I wear a few hats and work in both public and private sectors and have an interest in system change to move towards a more preventative health model, engaging citizens more widely, but also working with healthcare professionals, businesses, policymakers, etc., really to incentivize and promote sustainable health and well-being for all. So just a few words on how this all came to be in terms of the Open Life Data Framework. So I am the director of the All-Party Parliamentary Group for Longevity and also head up a new venture called Business for Health, consultation all around public health by business and businesses and employers, and really looking at the role of business in terms of maximizing health, but also reducing harm, taking a leaf from the climate change experience to bring health into ESG mandates, kind of like an ESHG framework rather than just an ESG framework to incentivize investment into long-term sustainable health and care and transformation. So this has a huge link and a parallel with the Open Life Data Framework. And both these initiatives came out of the work that we did with the All-Party Parliamentary Group a couple of years ago, starting with Health of the Nation, which began to really look at how to achieve this mission, which you see at the top of the slide, 5 extra years of healthy life expectancy while minimizing health inequalities. This was a goal that was set in 2017 to string together the objectives of the 4 grand challenges of the industrial strategy, which was AI and data, clean energy, mobility, and the aging society. And so the Health of the Nation was published right before COVID, actually, in February 2020. And 2 of the recommendations, the Business for Health venture that I mentioned, and also the Open Life Data Framework, came out of that and were referenced again in Leveling Up Health, which we published in April this year in 2021, right after coming out of the pandemic, and got a whole lot of support from our then Secretary of State for Health and Care, Chris Whitty, our current our CMO, and also Henry Dimbleby, who has just literally released the National Food Strategy, because food is actually one of the big areas that really needs attention in terms of leveling up health and dealing with the obesity epidemic, for example, and the food systems shaping that really is becoming a huge priority. And you can see on this slide also, the Open Life Data Framework was actually published in the Lancet on the eve of the Leveling Up Health report, and really pulls together the context and the rationale for why we're doing this. So why are we doing this? So the key purpose of this whole project of the Open Life Data Framework is really around, and we've got that on the slide, to make it easier to connect data across our lives to help understand how we can keep healthier for longer and reduce health inequalities. And who's involved in this? So the working group comprises about 45 experts who've been meeting together since last year. Actually, we informed and pulled together some of our recommendations for the national data strategy that closed its consultation December 2020. And the group is chaired by Lord James O'Shaughnessy, who's the former Undersecretary of Health and also visiting professor at Imperial College, and is directed by myself and Gavin Starks, who many of you will know. He's the former CEO of ODI and also was one of the co-architects of open banking and very involved in other areas like open energy, open finance, open pensions, etc. So, and we've actually received funding for this work from the Health Foundation and are currently working with a number of groups like the National Data Guardian, Ada Lovelace Institute, NHSX, Genomics England Turing Institute, and a number of other individuals from these organizations, and increasingly involving other stakeholders. And speaking at the moment, as part of our consultation that is running at the moment, it will have closed by the day of the ODI Unconference. But we're involving groups like the Centre for Data Ethics and Innovation, UKRI, our Future Health, BAYS, so many groups are involved in this process. And so essentially we're looking at what we can take from other sectors like open banking and the open standard to harness data intensive technologies and data to extend and make more equal the healthy longevity of British citizens over their life course. So what are our key goals? So our key goals are reflected on this slide. And so very, very briefly, we're trying to make better use of data and data-enabled technologies. We're trying to propose solutions for innovating and scaling up in the public sector, but leveraging data sets across from outside the sector, really looking at the digital health infrastructure to enable innovation that is more fairly distributed and resilient. And most importantly, it's to build public trust, which is the key thing in all of this. So what we're trying to do in this is to really focus on the 80% because of what actually keeps us healthy and well. Most of the determinants of our health are actually outside the health and care system, although many of us still think that healthcare belongs to the NHS. And actually, really what we're saying is that to be able to achieve our mission, which is 5 extra years of healthy life expectancy while minimizing health inequalities, you really have to look outside and look at, for example, that image that the Health Foundation has put forward. Is good health actually involves, so many other things like where you live, the food that you're eating, the environment that you live, housing, your socioeconomic status. These are all really, really important factors for our health. And this is what we're really focused on. So we talk about in the work that we're doing with the Open Life Data Framework is health relevant data. So that's data that's outside our NHS and care system. And this speaks to the whole concept of the exposome, which are, and you'll see in the slide here, the tree of life and the environmental exposures that we're all sort of affected by, like diet, housing, air quality, physical activity, which is obviously we have a choice over, but there are other areas like our built environment, our finances that are a bit less, which are less in our control. And this is where policymakers and government have a huge role to play. And the Open Life Data Framework that we're looking at is really looking at how we can harness, through an enabling data infrastructure and with the right governance mechanisms to harness data sets in both public and private sectors across the life course to develop personal, population, and pandemic resilience, linked to the 5 priorities of the report that I mentioned earlier, the Leveling Up Health report, which is very, very focused on, in the short to medium term, on obesity management, which I'm sure many of you will have seen has been quite visible. And obviously with Boris Johnson having himself come quite close to death, actually. I mean, he puts it down to being overweight, clean food, healthy children, clean air, and smoking. So those are really, really big priorities that we're looking at in the context of the Open Life Framework. And you'll see that reflected in the use cases that we focus the initial sort of work on, recognizing that actually to really understand how to create an enabling environment, you really have to look at the use cases to really start to unpick the barriers that otherwise prevent data sharing. So there are 3 use cases that we've selected, one of which some of you will recognize, Red Book for Life. If you've got kids, you'll get a Red Book, which gives you sort of access to vaccination status, etc. But actually what we're proposing is to create a digital Red Book for Life, across your lives, which we can, revisit at key points throughout our life, and then, and we're looking very specifically at weight management in this case. We're also looking at a healthy aging and longevity data exchange, really looking at the value exchange between all the different stakeholders in the ecosystem, which includes citizens, but also investors, and of course, healthcare professionals and the business community. And very specifically, we're looking at supermarket basket data to look at how we can incentivize healthier eating. Civic data cooperatives is really interesting. We're working with Ian Buchan and Gary Leeming up in Liverpool, and they've been really, really busy with the CIFA program, looking at harnessing data from a local public health perspective and working with anchor institutions and harnessing civic action to develop a much more rapid response to health needs on the ground. So really, really interesting use cases that have really helped us sort of unpick some of the things that we need to in this Open Life Data Framework. And really what we're saying is we're building on what some of you may have seen in the press actually a couple of months ago, that the NHS and Department of Health, they published the Data Saves Lives data strategy. And so what we're doing with the Open Life Data Framework is building on this and recognizing the value of data that sits outside the health and care system, the so-called health relevant data that I spoke to earlier, to enhance individual and population health and reduce health inequalities. And it speaks to the need that is being asked at the moment as they're sort of going into the next phase of the National Data Strategy for health, is the need for standardized integration of health relevant data, particularly at the level of the ICS, the integrated care system, which some of you may have heard about, which is really looking at place-based approaches to address our health, but also to address health inequalities. And what we're really saying is we want to support the flow of data across the system to support interoperability and develop standards that are open, that are accessible, that are usable, and which will fundamentally will promote frictionless data sharing and interoperability across silos. So what we've also done, and the way that we're approaching this with the Open Life Data Framework, is saying, listen, there's going to be a lot of questions. And I think one of, with what we're trying to do, and actually how does this interconnect with all the other initiatives that are taking place, both within the NHS and care setting, but also outside in other government departments, and of course linked to, and many of you attending the conference will be involved in sort of data in other sectors. And so what we're doing as part of the consultation process before we publish in October is looking at all the questions that are being asked about why we're doing this and what benefits it will bring to all the different stakeholder groups involved. So I'll just speak to a couple of the questions that have been asked. And these include, for example, and one of the big questions is around the language and the terminology. So a lot of people will ask, well, what is open data and what does open life mean? And I think and just from having been involved in quite a few conferences, and I'm sure this will be a big discussion point in the Unconference audiences as well, is what do we actually mean by open data? So this slide here comes from Gavin Starks at DGen, and reflects some of the very, very good work also that the ODI with their data spectrum slide that they share quite widely, which basically speaks to how data exists on a spectrum of accessibility from closed to shared and open. And obviously data can be accessed by an open API, which may be closed, shared, or open data. What we're also saying is that, you know what, we're not saying that, for example, our electronic medical records or health records should be accessible by everyone. Because a lot of people, they think when we talk about, open health, they think, oh gosh, do you mean that my medical records will be available to everybody? Well, no, we are of course not talking about that's personal data. And of course, there's a lot of data outside our personal health data that is incredibly useful. And of course, also speaks to the health relevant data that I mentioned earlier. So really what we're talking about is taking examples from other sectors and looking at open standards, reusable agreements that make it easier for us to publish, access, share, and use data. And also, that define access to the different kinds of data, whether it's open, shared, or closed. So we get a lot of questions about privacy. And of course, many of you will have seen some of the backlash in the press actually that happened with the so-called GPDPR proposal. In the press, they were talking about it as the GP data grab, and that our data would be sold for profit to drug companies, and all the sort of the hysteria that happened around all of this during the summer after the Data Saves Lives strategy that was published. And of course, we have to be very, very mindful, of course, our privacy, and of course, our confidentiality and consent must absolutely be observed and protected. And of course, this is not what we're talking about. But I think we're very well protected about, if there are data breaches, and this is which is covered very well by GDPR, there are already established processes for addressing them. And of course, data has been collected by NHS and NHS Digital in particular as the guardian, for a very long time in a very trustworthy way. And they collect coded data, and it does not actually include free text data, which would include, for example, your address, for example. And also, the detail is always, the devil is always in the detail. And of course, the Data Saves Lives strategy is very, very clear and very positive in terms of its intent. But I think they will say, and of course you will see this, that the government is very clear that this data will not be sold. And of course, re-identifying data, which has been a massive sort of concern, is also illegal. And some of the words that you might be finding and hearing about are words like the trusted research environments, which are very, very well established, for example, by UK Biobank and indeed the ONS and for example, HDR, Health Data Research UK. These are all, and you may have heard also with Ben Goldacre's group, Open Safely. These are all, and there's a huge move towards using those trusted research environments, which of course is also, which helps reassure people about privacy concerns as well. So another big question, and these are just some of the examples of what's in our frequently asked questions document that we've been building up, over the time that we've been running the consultation for the Open Live Data Framework. What's in it for society? And there's so many benefits of actually sharing our data. We hear a lot about the risks, but what we want to do is to engage people much more closely in their health by being much closer to the data. In fact, in the Data Saves Lives strategy, it speaks to getting citizens closer to the data. And some of you will know about a number of really interesting projects, like, for example, in Manchester, the solid project up in Manchester, personal data stores, for example. These all speak to looking at different models where citizens have control over their data. And of course, in countries like Estonia, they have a whole mechanism through their e-citizen program, where citizens are very, very close to data that they choose to share with whoever they choose in public and private sectors. And of course, with the pandemic here in the UK, the digital innovation has absolutely sort of boomed, and we have almost 2 million people now using the NHS app to access services. And of course, many of us are already using it to download our COVID vaccination sort of certificate so we can actually travel. So these all sort of speak to how I think the people are becoming more used to actually using their phones and using these apps and getting closer to their health, which will help to really expedite and accelerate the behavioral and cultural change, which is actually the most difficult one, to get people more engaged in a way that we are in other parts of our lives. So why shouldn't we be in the health context? So what's in it for the public sector? So obviously the Data Saves Lives strategy has spoken a lot to that, but we want to, if we're going to reduce demand on our NHS and care system and keep healthier, and of course the big lesson from COVID is that we were more badly affected than all other European countries because we were basically in poor health, and we need to address that. So of course, fundamentally, this is about creating an environment where we can really start to look at how do we keep ourselves healthy and well through a sort of a cross government approach, helping the new Office for Health Promotion, focusing more on effective preventative health strategies, and complementing other moves underway. For example, some of you may have heard that the ONS is building a health index, which is looking at health more from an asset-based perspective, from the perspective of healthy people, but also the lives that we lead, but also the healthy places. And of course, that links very, very closely to some of the initiatives in terms of leveling up. And of course, we're saying we need to level up health and really close the gap in terms of healthy life expectancy, between the poorest and our richest citizens. And of course, we also want to support the development and implementation of the integrated care systems, which is a big focus at the moment in the NHS and care system. So what's in it for the private sector and taking this multi-stakeholder approach? Well, we want business to play a much bigger role in population health and to help us to identify and share private sector data that matters most to keep us healthy. For example, in workforce health, the private sector has access to data that will help us understand what is putting people at risk for musculoskeletal conditions and, of course, mental health. So these are big areas where the private sector have a huge role to play in terms of reducing demand on our NHS and care system through really good workforce health and well-being programs. And this includes also, for example, the NHS is one of the biggest employers in the world, in terms of workforce health. We also want to catalyze, and augment collaboration between the public and private sectors and bring down the walls that otherwise prevent sharing data in the interest of and really looking at harnessing data for the public good, addressing the needs and interests of taxpayers, government, and businesses, and of course, citizens just generally. We also want to unlock the ability to connect data sets for innovation and kind of taking a leaf from what happened in the fintech space with data portability and driven by regulation, where the banks had to open up, and this is where the open banking standard came in. It started to really catalyze the fintech ecosystem and developed a huge raft of different products and services that consumers wanted to use. And we want to see the same thing happen in the context of health and to really support our startup sector. I mean, we hear about building back better and supporting, the tech sector, but this is, and we hope that the Open Live Data Framework will really help to release that innovation, because at the moment, startups find it really, really difficult to access and scale up in the NHS. So really fundamentally, and I'm this is the close of my presentation, trust is at the center of everything. So we really need to bring out, and this is the fundamental question that we're addressing in the Open Live Data Framework, is how can we protect trust, build trust, and make sure that we don't damage trust, because that really is the bedrock of everything. And I'll just say the National Data Guardian, who we've been working with, I mean, they have done quite some very, very interesting work with citizens' juries, and recently published Putting Good into Practice, a public dialogue on using health and care data. And their key findings were that actually, if you're looking at improved health outcomes, reducing health inequalities, and promoting independent living, the public are on board with that. And of course, we'll certainly share their data to achieve these sort of so-called public benefits, but they'll also be very happy to share data for other uses, as long as it brings benefit to wider society, and obviously in addition to themselves. And more recently, we've had other reports. The NIHR produced a report, and of course, the Ada Lovelace Institute are looking very closely at this. And I think, in the end, public, trust is at the center of everything, and remains a massive focus of all the work and the principles that will be enshrined in the Open Life Data Framework when we publish it in October. So that's the end of my presentation, and really, I'm very, very grateful, for your time, and hope very much that you will be on this journey with us as we kind of develop the Open Life Data Framework to benefit everyone, and to really sort of drive some of the system change that we really need to, so that we can make preventative health and care much more of a focus, and really drive the system change needed across all stakeholders in the ecosystem. So thank you very much.